UNC brings those top 1% and 2% and 3% of students all across the nation, specifically here in North Carolina. And so when they got here, they had that pressure of, instead of being praised and accoladed for everything that they're used to accomplishing, they were just a fish in a big pond.
We get a lot of reports of the isolation and loneliness and just having difficulty with connection and belonging across campus.
The reason why a lot of our students were saying that they needed connection was because there wasn't someone there to see when they were struggling.
That really brought it to the attention of our chancellor and helped us to formalize the mental health first aid program at Chapel Hill.
I would describe mental health first aid as a way of walking alongside people to support them as they are identifying the resources that they need, whether within themselves or around themselves, to move toward recovery.
Mental health first aid just gives you language to be able to address that person or to speak with that person whenever you're wanting to, but you don't have the words to.
I just have not found a course that has the breadth and depth that mental health first aid has when it comes to mental health and substance use challenges.
Mental health first aid can be helpful in creating a set of skills that don't feel so heavy and academic, but feel relational enough that they can use them really anywhere that they go.
The private instructor trainings were pivotal when we were starting the program in terms of scaling and getting a lot of instructors trained at one time. Now we have about 70 current instructors that are active with our program that are teaching either on campus at UNC-Chapel Hill or across the state of North Carolina.
My instructor training for mental health first aid was wonderful. The instructors came from the National Council and they were very patient, engaging, funny. I loved the cohort of folks that I learned from.
Since our program has been implemented, we've received data that has shown an increase in our participants' confidence to intervene and definitely the confidence in asking directly about suicide.
From a faculty and staff perspective, it really helps give them language so they can have a conversation before they kind of refer them to be able to get professional help or to get appropriate help, but at least be able to start from the foundation there.
I know my mental health first aid instructor training is working because people keep coming.
In order to scale a mental health first aid program at your organization, you should definitely take advantage of the private instructor trainings because you're able to train a good amount of instructors at once and you're able to actually plan how you're going to support those instructors. When it comes to convincing anyone about investing in mental health first aid, the evidence really speaks for itself.